Hi, it is Thursday, April 9th. I am here at the state capitol with Dr. Janae Caldoun, our chief medical executive here for the state of Michigan. I want to begin by wishing everyone who celebrates a happy Easter as well as a happy Passover to our Jewish residents who are celebrating as well. I know that there are a lot of Michiganders who usually come together to celebrate holidays or weekends, for that matter, with family and friends, and that this is a unique and challenging time. I hope that you are finding other ways to reach out to loved ones during this time as we celebrate, as we cope, and as we navigate these unsettling times. Since Monday, we announced that the state of Michigan has selected the Suburban Collection Showplace in Novi with collaboration with Ascension Health as the site of the second alternate care facility to expand medical capacity during the state's response to COVID-19. After conversion, the Suburban Collection Showplace will provide bed space to accommodate up to 1,000 COVID-19 cases. And as we announced that the Henry Ford Health System, McLaren Healthcare, Beaumont Health, and the Detroit Medical Center will serve as partners providing critical support and staffing resources at TCF Regional Care Center, scheduled to accept its first 25 COVID-19 patients this Friday. The United States Army Corps of Engineers has built this hospital from scratch in a matter of days with the Michigan National Guard, and we brought competing healthcare systems together, joining forces to help get this up and running. It is truly a remarkable thing that has been accomplished, and I appreciate the Army Corps, the National Guard, and the leaders of these health systems for stepping up to make these announcements and this care possible. I also sent a letter to Vice President Mike Pence about the severe shortage of critical medications used in providing care to COVID-19 patients in Michigan. You know, we are faced with dangerously low levels of the medications required to safely place patients on ventilators and ensure sufficient sedation and pain relief while they remain on ventilators. These medications are just as important as the ventilators themselves. Specifically, I asked the Vice President to improve coordination across all agencies to ensure a steady supply of these essential medications as quickly as possible, and to direct the DEA to allow for more of these drugs to be produced. I was pleased to see that following my request, the DEA announced that it will temporarily allow for increased production of medications used in treating COVID-19 patients, and that they would approve increased imports of medications as necessary for patients who are on ventilators. We're grateful because that's critically important. I've also signed a few executive orders. I signed one to temporarily suspend requirements regarding licensing and regulation of emergency medical services. And I signed one to reduce unnecessary in-person contact through the use of electronic signatures, remote notarizations, remote witness attestations and acknowledgments, and remote visitations. We're doing everything we can also to get food benefits to Michigan families and people who need it. The USDA's Food and Nutrition Services has approved Michigan's plan to provide pandemic EBT SNAP benefits to children who are approved for free and reduced lunch in our schools. Michigan is the first in the nation to get this approval, and we are incredibly pleased about that. This approval will allow us to provide SNAP benefits to our kids to cover the cost of that school meals would have provided had they been in school. This is a value of about $193 per month per child. $172 million per month will be going to Michigan families and kids. And this gives the Department of Health and Human Services the ability to serve approximately 895,000 children, ensuring that they have access to increased food security. And these funds will be in addition to meals that are being distributed at school sites. We're working around the clock to help those who are still trying to navigate the technical issues in filing unemployment. The UIA has nearly quadrupled staffing levels over the last several weeks and has extended call center hours by an hour every day, 8 a.m. to 6 p.m. Monday through Friday, and remains open on Saturdays, 7 a.m. to 2 p.m. The last 3 weeks from March 15th through April 4th, Michigan has seen 816,785 total claims. We know we're not alone in this high unemployment. In fact, every state in the nation is confronting the same thing that we are. 6.6 million Americans in the last week alone have applied similarly. Compared to the 3 weeks ending February 29th, March 7th, and March 14th, prior to COVID-19, this represents a 5,000% increase. I'm committed to making sure that every eligible Michigander receives their unemployment benefits. I appreciate your patience. We'll have an update on numbers. As of today, we have 21,504 confirmed positive cases of COVID-19. Sadly, we have lost 1,076 Michiganders to COVID-19 fatalities. The number of deaths has increased and will continue to increase, and that's precisely why we've got to continue taking this so seriously. So I want to talk a little bit about models of what could happen in Michigan over the next couple of months based on a number of factors. If Michiganders do their part and stay home and stay safe and wear a homemade mask when they do have to leave the house, while they're practicing the other social distancing and hand washing, we can see how many businesses maintain safe work environments for essential employees. That's another factor. And the third factor is the amount of PPE we can get from our own procurement, from the federal government, and from private donations and ramping up here in Michigan to help our essential employees stay safe. These are the factors that go into the models that determine how long we're going to be in this posture. Now, on this graph, the purple line is the IHME from the University of Washington model that the White House has been working off of. That model predicts our peak this week, actually, in the last couple of days. We believe that they're basing their distribution of PPE on this model. It assumes a very high level of adherence with sheltering in place, Wuhan, China style, that is not happening in Michigan or anywhere in the country. So that's one assumption that we think is contributing to this timeline that we don't see happening here on the ground. This model also doesn't represent the reality of what is truly happening, the number of cases, the number of people in critical care, and the number of deaths that we have continued to see rising every day. The more likely scenarios, based on the data that we have seen and what is actually happening here on the ground in Michigan, is the blue and green line on that same chart. Now, the green line is what can happen if everyone does their part. If we act now and we continue to stay at home under really aggressive scenario, you can see that the line will start to flatten. The blue line is what will happen if only some of us observe those rules. And the red line is what would happen without any stay home, stay safe order and without social distancing. You can see that we are in control of our fate here, and it depends on every one of us doing our part. I'll go to just make a couple of observations. These lines aren't just colors on a graph. If we can go back to the last one. They're not just colors on a graph, but this represents people's lives. This represents your grandmother, your child, your sister, your brother, your coworkers. When we all take this seriously, we will save lives in Michigan. We will save the frontline healthcare providers that are struggling to keep up with the need. And we will come out of this in a more robust way where we can get our economy re-engaged. I would like to go to the University of Michigan model that my team and I have been using, modeling that comes out of the U of M. It's helped inform a lot of our decisions as it is based on information that is coming right out of here from the state. This model shows what can happen when all Michiganders stay home and stay safe through May 3rd. That is the blue line. That's what the curve can look like if we stay socially distant through April 30th. The red line through April 13th. So that's what our curve will look like if we stop social distancing now. And the black line is what we would have looked like if we hadn't done it in the first place. As you can see, these actions make a big difference. By observing social distancing, by adhering to the stay-home order, we're going to protect more families, we're going to save more lives, and we're going to help ourselves get back on our feet sooner, which will be better for our economy in the long run. So this has been a hard month. We've got to take the lessons that we've learned from it and use them for the betterment of our state and the betterment of our people.